Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is June 8, 2025. This video is an article published in Nature Medicine on June 6, 2025, titled Adjunct to Insulin Therapy Using SGLT2 Inhibitors in Youth with Type 1 Diabetes, a randomized controlled trial. SGLT2 inhibitors reduce risk of CKD, chronic kidney disease, in type 2 diabetes and shows promise in type 1 diabetes. Youth with type 1 diabetes often have suboptimal glycemic control and early hyperfiltration. The ATTEND trial evaluated dapagliflozin as add-on to insulin in youth 12 to 21 years with type 1 diabetes. The aim was to assess the effect on GFR, glycemic control, and safety. Methods: who, what, and how. Double-blind, randomized controlled trial with 98 youth 12 to 21 years, 53% were female, randomized 1:1 to dapagliflozin 5 mg versus placebo. 22-week protocol, 4-week pre-treatment, 16 weeks of therapy, and 2 weeks of post-treatment. The primary endpoint, change in measured GFR via eohexol clearance. Baseline, mean age 16 years, mean hemoglobin A1C 7.7%, mean diabetes duration 7.3 years. Statistical analysis adjusted for baseline GFR and study site. Results: dapagliflozin reduced GFR by about 8.8 mL per minute, p-value 0.0001. Hemoglobin A1C dropped by 0.47% and time in glucose range rose by 9%, p-value 0.001. Body weight decreased by 2.8 kilos. No change in insulin dose. Safety: only mild DKA. No increase in UTIs or hypoglycemia. Limitations of the study: short duration 16 weeks. Low baseline hemoglobin A1C may limit generalizability. Key takeaways: what have we learned? Dapagliflozin is effective as adjunct to insulin in youth with type 1 diabetes. It improves renal hyperfiltration, glycemic control, and weight without increasing DKA risk under proper protocols. Provides a potential path for early chronic kidney disease intervention in adolescents. Clearly, long-term studies are required to assess progression of kidney outcomes. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.